Okay, I am blessed in the county to have so many smart and talented, mostly young people, working for me. And I am particularly pleased that Andrea was willing to come and give us a hand. Being budget director is a very difficult, challenging task. And she plunged right in 15 months ago and has done a really wonderful job. And she's here today to tell you a little bit about the challenges we face and her solutions. Thank you very much, Andrea.
Thank you, Madam President, for the kind introduction. I'm glad to be here to talk with you all today. I'm here to speak with you about the state of the county's finances and the approach the county has taken to improve the budget process and financial outlook. Right now, governments at every level are finding themselves having to do more with less, and Cook County is no exception. Since taking office, the President has been vocal about the scope of the fiscal challenges facing the county. The President outlined 4 basic tenets for us: fiscal responsibility, innovative leadership, transparency and accountability, and improved service. It should come as no surprise that fiscal responsibility is first. Right now, we are crafting our 2013 budget recommendation, which will be the 3rd budget that President Preckwinkle will have overseen in less than 2 years in office. This administration has resolved a 2011 deficit of $487 million, a $315 million deficit for 2012, and we're working on resolving the $268 million deficit for 2013. This means we will have resolved over $1 billion in budget gaps in less than 2 years. The guiding principles and methodology used in the budget formulation and planning have been the same each time. Focus on structural changes, not one-time fixes, reduce the size and cost of government, and above all, minimize the impact on taxpayers of Cook County. Today, I will specifically address our efforts to lower the population at the Juvenile Detention Center and the Cook County Jail. I will also discuss opportunities to improve patient care and fiscal viability of the Cook County Health and Hospital System. And finally, I will focus on the reduction of the sales tax. It is important to point out that we will have resolved $1 billion by the end of this budget. And all of these initiatives that we're highlighting play a role in that. But I'd like to note that getting to $1 billion in solution means a lot of hard work for the bureau chiefs and department heads who are here today. Before we delve into the specific areas, I would like to provide a little background on the county's $3 billion budget and budget process. Of the operating budget, about 51% is related to public safety expenses, 36% is health and hospital expenses, and the remaining 13% covers property and taxation functions and other government functions. Let me talk about some of the improvements we have made to the budget process. After all, the first step to a responsible budget is a responsible process. We had to start by making sure we got the budget done on time. The county's fiscal year ends November 30th. However, state law says the county doesn't have to pass a budget until the end of the first quarter. It might seem like an obvious thing to have a budget in place before the beginning of the fiscal year, but in recent years, that wasn't the case. In order to begin the budget process sooner, the President issued an executive order requiring a preliminary budget process. For the first time, Cook County was required to provide a formal preliminary budget in June of each year. This way, we could assess the revenues and expenditures for the coming year and identify the scope of the shortfall. Furthermore, the executive order required making a budget recommendation to the Board of Commissioners by the end of October, so that the budget could pass before the end of the fiscal year in November. The process also ensured that more opinions about the county's budget could be incorporated into the recommendation. requiring the President's office to hold a public hearing on the preliminary budget. We had to work on fixing the budgeting process, but we also had to address some fundamental challenges President Preckwinkle posed for us at the Budget Department. How do we ensure that we are providing effective and efficient services for county residents in a fiscally responsible manner? Good budgeting requires asking what dollar you spend will bring you in return. I have spent the majority of my career working on budgets and asking questions about the level of service associated with each dollar spent. In other words, what does a particular budget buy for the taxpayers? When I first started with the county in May of 2011, it was clear that those questions had not always been asked. I quickly had to learn how the county had worked, and then I needed to implement what I know works. For example, there were budgets in prior years that reduced funding to the county's Department of Revenue, thereby limiting the county's ability to effectively audit businesses to see if they were really paying their fair share of taxes. This was a quick budget fix that actually ended up costing the county, as one auditor can recapture over $300,000 in lost revenue. What we have demonstrated and will continue to demonstrate is that it is possible to offer better service at lower cost. I call it having your cake and eating it too budgeting. As I walk through some specific examples, you will see that policy goals and financial goals can actually align. These goals represent tough challenges on their own, but are even more challenging given the current economic climate. Some of these priorities even require a fresh level of investment. Where was the money going to come from? I won't pretend that I saw an immediate budgetary path towards addressing these issues, but I can tell you about one eureka moment that illustrates much of the process we have gone through. The President, along with the people who run the Juvenile Temporary Detention Center and juvenile probation, wanted to focus on alternative approaches to detention to promote better outcomes for juvenile offenders. The argument was that we should focus our resources on community-based alternatives which provide counseling and other needed services. This approach allows youth to remain closer to their families and communities and therefore have better opportunities to continue their education and employment. A few of us from the budget office were meeting with juvenile probation, going over their budget. And as we sat there, I could see a light bulb start to go on. One of our analysts asked, so what you're proposing is both better for juvenile offenders and less expensive? Quite a bit, it turned out. It costs $600 a day in direct and indirect costs to house, feed, clothe, educate, and guard each juvenile offender. By contrast, investing in community-based alternatives costs less than $75 per day. Through this effort, we've been able to reduce the number of offenders held in the Juvenile Temporary Detention Center from about 300 at the beginning of the year to a sustained population of less than 260, or at least 40 fewer offenders. Let's do the math. That means $525 saved per day for 40 offenders. That equals $21,000 per day, or close to $8 million for a whole year. While all of those savings don't come back to the county, and not all in the first year, it still has a substantial impact on the budget. For the 2013 budget, we are saving close to $3 million as a result of aligning our policy goals of getting kids out of detention and our fiscal goals, spending less money on the detention center. We applied a similar approach to the adult population at the Cook County Jail. In this case, the focus was on increasing electronic monitoring, which allows individuals to remain in the community while lowering the risk that they will skip their court date. This year, the county successfully doubled the number of people who were sentenced to electronic monitoring on any given day from 500 to 1,000 people. And this increase in electronic monitoring happened at a time when the jail population, for a variety of social and economic reasons, was on the rise. But looking at the issue purely in terms of costs, it costs $143 per day to keep an inmate in the jail when you include all the direct and indirect costs, whereas electronic monitoring is only $75 per day. We are moving to reduce the adult jail population and its attendant costs in other ways. The recession increased the number of nonviolent offenders charged with low-level offenses who can't post bond, so they await trial in jail at a cost to taxpayers, and many of these individuals could be playing a productive role in their homes and communities. To help address this, the county is investing in the process by which public defenders obtain information from defendants before their bond hearing. This will help ensure that judges hear accurate and verified information that may impact decisions regarding release. We knew that lowering the jail population with all the complicated factors at play would not happen overnight. But the cost to taxpayers and the effect it has on many residents throughout the county make it a top priority. The goal remains to have people who are not a threat to society out in the community safely, where they are both less expensive to the county and more likely to achieve positive outcomes in their lives. Again, policy and budget priorities fall unexpectedly in line. Now let's turn to President Preckwinkle's next big budgetary challenge, the Cook County Health and Hospital System. It is important to remember that most of the 350,000 patients who are cared for by the county health system are residents without insurance or any other access to health services. In fact, more than half of the patient population has no means to pay for the services they receive, which is higher than New York City and many other cities throughout the country. We need to find a way to preserve and even improve these services. We've already identified a number of efficiencies in the health system that won't negatively impact patient care, including renegotiating vendor contracts, getting better pricing on supplies, reducing overtime expenses by prioritizing hiring of certain physicians, consolidating telecom functions with the Bureau of Technology, and incorporating human resources oversight with the rest of the county. Unlike the juvenile detention problem, the hospital budget challenge did not produce any single crystallizing moment for me. Rather, it required pursuing policy with two complementary approaches. First, requiring patients who are able to pay for services to actually pay for them. And second, taking advantage of a new care model made possible by the federal government's Affordable Care Act. For the first approach, requiring payment where feasible, it meant a major culture shift on the part of the health and hospital system physicians, who hold in many ways admirable view that they are doing good for the needy by performing services for free. But there are obviously gradations of neediness and the larger question of overall health and hospital system effectiveness. I have to give credit to Health and Hospital CEO, Dr. Ram Raju, who's here, who has been persuading his fellow physicians that every dollar they don't bill a patient who is able to pay is a dollar they are simply taking away from another patient who can't pay. Physician billing, which was minimal a year ago, has generated $4 million so far this year and is projected to increase next year to $13 million. Granted, this is only a small part of the roughly $200 million in patient fee reimbursements the health and hospital system receives, but it is critical nonetheless for the fiscal stability of the health system. The second approach, accessing the potential funding opportunities offered by the Affordable Care Act, presented a conundrum. We had an opportunity to apply to the federal government for an early start to the Affordable Care Act that allows greater Medicaid reimbursement for our patient population. But to be eligible for this reimbursement, the health and hospital system had to invest in providing broader services than traditionally offered, as well as a new administrative structure to manage the program. These new obligations require fresh investments, such as contracting with mental health and substance abuse treatment service providers. Much of that spending will enable patients to take greater advantage of preventative primary care and thus lessen the cost burden of far more expensive treatments they receive through emergency room care. This new source of reimbursement will be critical in aiding the health system to improve their finances and provide more care to individuals most in need. But it did lead to some difficult decisions that had to be made. Because of the health system's challenging financial history, the county has had to subsidize the health system. In 2010, the county budgeted a subsidy of $389 million. In 2011, it came down to $276 million. And in 2012, it was reduced further to $254 million. For the 2013 budget, the county is sustaining this $254 million subsidy because we can see for the first time the possibility that in a few short years, we could be able to substantially reduce the county's subsidy. If you recall, the gap we are working to resolve this year for 2013 is $268 million. $152 million of this is attributable to the health and hospital system. This part of the gap is being resolved within the health system budget by various non-personnel and vacant position reductions, receiving incentive payments for converting to electronic medical records, and for our application for expanded Medicaid coverage. Finally, let's turn to the sales tax. As you know, President Preckwinkle and the Board of Commissioners reduced the sales tax by 0.25% last winter and has scheduled another 0.25% reduction January 1 of 2013. In a time of economic recession, we have had our share of people telling us that we are foolish to cut such a large source of revenue. But we have actually been pleasantly surprised to see sales tax revenues rise consistently against our projections. We had initially assumed our tax rollback would mean a loss to the county of $440 million, but more recent projections peg that closer to $410 million. So what's going on? Are some county residents now less likely to make an out-of-county trip to purchase goods? Probably. Does that mean better business for in-county stores and more tax revenues for the government? Most likely. And as sales tax falls again in January, we'll no doubt see more such behavioral changes at the margin, improving business activity in Cook County and slowly strengthening the economy. For the 2013 budget, this means $10 million more than what was projected just 1 year ago. The three examples that I have outlined for you today, the reduction in the juvenile and adult jail populations, the transformation of the health system, and the reduction of the sales tax, are all important policy initiatives in their own right. But as a budget director, these initiatives are not only about advancing our policy, they are also about investing in our long-term financial stability. It is easy to overlook a long-term view of budgeting as we focus on thinking narrowly about annual appropriations and immediate budget shortfalls. Implementing policies that have a multi-year financial impact allow you to think past the current fiscal year. In the 2013 budget, we are implementing a number of cost-saving initiatives that seem more mundane by contrast, but are no less important to the county's fiscal outlook, both because they save real dollars in the coming year and they help us preserve service levels for critical functions. Some examples include $3 million in additional savings from vendor contracts, $6 million in reduced health benefit costs by aligning benefit plans, and $250,000 from streamlining vehicle usage. With approximately 80% of costs tied to personnel, closing a budget gap of this magnitude has to consider position reductions. Over the past two budgets, we have been able to reduce the number of positions by close to 2,000. This year, we are eliminating open positions or positions that have been vacated throughout the year a top priority. Obviously, our first focus is to reduce expenditures, but we are considering some limited revenue initiatives to include in the 2013 budget. The focus of any revenue initiatives will be to close loopholes, incentivize behavior, advance policy, or recoup user fees. This is just a preview of our approach as we finalize our budget. There is still a lot of hard work and collaboration that needs to take place. We will put forward a budget that matches policy goals and fiscal constraints. It will be a budget that prioritizes more effective treatment of juvenile and adult offenders. It will be a budget that makes the right investment in patient care and establishes a path to substantially reduce the health system subsidy. It will be a budget that follows through on the pledge to reduce the sales tax for Cook County citizens and businesses. Above all, it will be a budget that controls the cost of government and prioritizes key policy initiatives and outcomes. Thank you for inviting me today. I'm happy to answer any questions you might have.
Well, half the audience are people who work with you. This would be kind of tough. Okay, this is from John Mick Baxter and Woodman. Where are you, John? Raise your hand. All right, back there. Andrea. Well, there you go. Thank you. How has or will the budget been affected by shared services or joint projects with the City of Chicago?
We've been working with the City of Chicago on collaborating in a number of areas, and we've already identified over 30 million, I think around 33 million between both the city and the county on things that we've been able to do together that are more cost effective. Purchasing goods is an obvious one. We have a greater economy of scale when we purchase things together. We've been working on the election departments and making sure we're implementing best practices. And we've identified some areas in information technology too, where we can work on purchases together and save substantial money for the county. Pardon? No.
Jay? Nice pen, huh?
Not mine. Rogers. Dr. Rogers.
Boy, she glommed onto that pretty quick. By the way, you want to keep working with the city, I would tell the president maybe cool some of that patriotism about the baseball scores. Just Joy Saxon, City Club board member. What is the next loophole on which you intend to focus next in the next coming year?
I assume this is a question about revenues, is that correct? In terms of the budget, we're evaluating a number of revenue proposals.
What's your very next thing?
No. I'll talk about a loophole that we closed in last year's budget, and we're considering a variety of initiatives for this year's budget. One of the loopholes we closed last year was taxes on cigarettes. There were taxes on cigarettes, but there weren't taxes on other tobacco products. So we applied taxes on other tobacco products so that it would level the playing field there. So we're considering a variety of options. I'm not prepared to go through them today.
Well said. Well,
I have to talk to her first.
I was going to say, any other questions? Going once, going twice.
Right here.
Chris Long, board member, has special privileges. Not that you're not all equal. Thanks, Chris. This is from Chris Long, a longtime City Club board member. I'll finish the sentence. What has been your outreach to the townships, and how's it working out?
To the townships?
Yeah, there's 30 of them.
And they can be a real swamp.
I myself have not engaged in outreach to the townships, but we, whenever we have a chance, there are other people in the Cook County administration who work with township governments, with other municipalities to make sure that what we're proposing doesn't have dire consequences for them. One example is this past year, we eliminated weekend bond court that had very few people being processed through weekend bond court at the various courthouses, and so we changed the way that we approached that, and we had to work through a number of issues with the municipalities in order to address that, to make sure that they didn't incur more overtime and it wasn't more expensive for them.
How about a nice round of applause? We got some fun and different.
Oh, yeah?